Good morning. This is the A-Team on Traxx FM. That's you two in the background fading away over there. Mary and the Green Man here. Hey, Mary.
Good morning indeed. Colorectal Cancer Awareness Month is right now in March. That's why we are speaking to head of the Cancer and Health Screening Clinic from the National Cancer Society, Dr. Dalila Kamarudin, joins us on the phone lines. Good morning, doctor.
Hi, good morning.
Hi, doctor.
Hi.
And how is your day coming along?
Very busy.
Very busy is good.
Yes.
Well, tell us what's being done in Malaysia, doctor, for, to observe the Colorectal Cancer Awareness Month.
What we're trying to do is that to do the awareness among the Malaysians to know that if they have any changes in their blood, if there's changes in the stool, if they have blood in the stool, it's a sign of something which is not right. So a lot of awareness are being given because most people do not know how to screen for colorectal cancer. What is colorectal cancer?
That's correct. Are there other times when you don't have to worry and times that you do have to worry? For example, if you have diarrhea for 2 days, would you have to worry about that? If you have diarrhea for 2 weeks, would you have to worry about that?
The most common symptoms of colorectal cancer is you see there is a persistent change in your normal bowel habits. For example, diarrhea or constipation or both that lasts longer than about 3 to 4 weeks. Then it should cause you a concern.
Right.
Wow.
Right.
Yes.
Are Malaysians generally aware of this? Are there enough people who come forward and see you in time, or do they actually come over when it's a little bit too late? At which stage of the cancer would it be by then?
Well, I guess Malaysians, they always this attitude of tak ada apa-apa. So even if they have symptoms of diarrhea or constipation, most of them will give reasons, or maybe because of my diet, or maybe I was not.
They think it'll go away.
Yes. So that's the thing that we are trying to tell the outside people, that especially if you have any changes, if you see that there are frequent stomach discomfort, like you're feeling bloated, fullness, or any cramps, do not take it for granted it's just gastric, or do not take it for granted it's just your normal, menstrual period and so forth. You should have the sense of something is not right if it consistently changes in your overall body. It also, because usually the signs of symptoms of colorectal cancer is also accompanied by some weakness, you feel tired, and you feel that there is no weight loss for no reason.
Right. Are there screenings being done, doctor, to see this beforehand, prevention?
So that is why we encourage people for those ages 40 years and above, because colorectal cancer is very common among 90% of them are for those who are above 50. If you are 40 to 45 years and above, just come to have a screening on your blood, on your stool. Most people say leceh lah, because it's a bit how shall I say? You are sending your stool, to be
right.
And then you do a colposcopy when you're about 50 years and above, just to see if there's anything which is abnormal, any polyps in your colorectal segment. That is the best thing that you could do for yourself to screen for colorectal cancer.
That's right. So what's the procedure like? If I want to go for screening, what happens first?
Okay, what happens is that you can come and see the doctor, say that I would like to screen for colorectal cancer, and then I say, okay, it's good if you can come with a stool for that morning stool before you go to the clinic.
And sorry, but doctor, how would you require that stool to be brought? Yeah.
Right.
How?
They'll give you a container.
Okay.
And then you just come and give us, and then they'll send it to the lab.
Okay.
There's also some other tests that is coming out where, you can just send it, like the urine pregnancy test kit. In some labs they do that, you just take it to stool, and within few minutes they know whether you are positive for blood in your stool.
Fantastic.
That is in certain labs, yes.
Yes.
Wow.
Oh, that's good. Advancements in that is what we need, yeah?
Absolutely, since it is, the second most common cancer among men in Malaysia?
Yes, the second. Yes, exactly.
Wow, that's alarming.
Right. And back to your one of your other symptoms of it, you said feeling bloated, right? Could this also be like, all of a sudden a person who has a normal 2 to 3 times a day meal, or meals 2 to 3 times a day, and then all of a sudden this person feels like, hey, 1 meal is enough for me, but he's getting excited because he thinks, look, this is the way I can actually cut down on food.
I only need to eat,
I only need to eat once a day. is that actually a healthy thing when you eat once a day only? Or is that bloatedness maybe associated with this cancer? Maybe.
When I say the feeling of bloatedness, flatulence, it's just that you're feeling, you're not feeling comfortable around your abdominal area. It's not that when you have one or 2 days and then you feel bloated, then you say that that's a sign of colorectal cancer. It's not. It's just like a persistent bloatedness, and then you feel as if there is also associated with cramps, and you know that it is abdominal cramps, that you know it is not normal for you.
Right. Okay. So just that desire to have one meal a day does not necessarily mean that at all. Yeah.
Yeah. Right.
And what else should Malaysians be aware of, doctor?
Especially, all of us know that colorectal cancer is a lifestyle cancer. I would call it a lifestyle cancer because basically it's more on your diet.
Right.
Let's say if your diet is high in fat and low intake of fibers, that is also a risk factor if you are those who are only taking those type of diet. And then if you're not exercising too much, you are leading a very sedentary lifestyle, sitting down most of the time, you're not exercising, you're a smoker, you're alcoholic. That adds up to your risk factors for colorectal cancer.
That's right. Always the smokers in there and the ones who are just sitting down, not doing anything also, yeah?
Yeah. There's no movement of your bowels, you are just sedentary.
That's right. What's good to eat, doctor? I mean, what's good for people to actually consume a lot more besides, or what's a good habit for them to take on instead of having the habit of eating junk food? Yeah.
Oh, yeah.
I would say they always eat a balanced diet. Balanced diet meaning that you have lots of fruits and vegetables. You can take your carbs, for example, and then you have more of those fibers in your intake of your diet. Reduce your intake of fat, especially, and all those high proteins, for example.
That's right.
And doctor, when people go for screenings and let's say they detect it very early on, what happens then? Okay,
for any cancer, for example, if you say you are detected early, what we try to do is that we try to remove the source of the cancer. Now, if it's detected early, what we do is that we remove the polyps, which is very common in colorectal cancer, where we find all these polyps in your lining of your intestine. So we remove that during the colonoscopy itself. And then if, let's say, for example, we see a larger polyp that could be suspicious, then what we do is that we do a resection of those polyps, that is larger polyps. Then if, let's say, for example, we could see a large bulk of those masses in the intestine, then what we do is that we do a partial colectomy, meaning we remove part of your colon that contains the cancer.
Okay. Should people with a family history of cancer be more, aware of this? Should they take more precaution?
Having a family history does not mean 100% that you're going to get the colorectal cancer, but it is a risk factor. So what they should do is that maybe they could start screening early, or they are more aware of their diets and try to reduce the risk factors. For example, less smoking, less alcohol, more balanced diet, but go for early screening for all those stool in the blood and so forth.
Absolutely.
Are you seeing an increase in Malaysians who are having this problem, or are you seeing an increase?
Yes.
An increase?
An increase, because we have more than 3,000 cases per year for this colorectal cancer, where males are more prominent rather than the females. In males, it's about 14%, whereas in females, it's about 10%.
Wow.
And that's why I always to reduce your risk for having any cancers, diet is an important role.
That's right. So dramatically it has increased over the years, yeah?
Yes.
Not nice at all. Not good at all.
Thank you for joining us this morning, Doctor.
Welcome.
Well, thank you for that. Yeah,
have a good day.
Have a lovely day, Doctor. Thank you so much. Wow.
Dr. Dalila Kamaruddin joining us, giving us an insight on what to be aware of and what to pay attention to for colorectal cancer.
That's right.
You think that maybe some people are thinking, oh, this is a guy thing, it's just a guy thing. It's everybody. It affects men and women as well.
And women, yeah. And the thing is, we're in denial a lot of times. We just don't want to know.
And you don't want to talk about it.
You'd rather not find out.
Right. I mean, I appreciate how you mentioned that Malaysians don't really want to talk about cancer. Like, let's say you have a friend who has cancer and you sit with them and you don't want to mention it.
Right.
The fact is, you need to talk about it and say, okay, what's going on? I want to understand your disease. So what can I know about it?
Yeah, that's true. It's not like a taboo. It's not like you've done anything like, what's
how
going
dare
on?
you
Come
ask
on,
me?
let's get real 2016.
Oh, yes. If you want more information, you can always log on to www.cancer.org.my.
Live life.